Hello, have you been experiencing hot flashes, tingling, insomnia, sweating more than usual, or has your memory been failing you? Well, all of these could be symptoms of menopause, the topic of today's video. Did you know that 4 out of 5 women going through menopause complain of unwanted symptoms? That's why it's so important to understand more about this phase of a woman's life. Welcome to the Healthy Over 40 channel. Before we dive into today's topic, don't forget to subscribe to our channel so you won't miss out on more health and wellness content for people over 40. If you are experiencing menopausal symptoms that are bothering you, stay tuned. I will break this video into 2 parts. In the first part, I will talk about what menopause is and its 10 most common symptoms. In the second part, I will reveal 5 things no one ever told you about menopause, and most importantly, I'll provide tips on how to navigate this phase with the best possible quality of life. Let's begin. What exactly is menopause? Menopause happens when a woman's ovaries stop producing the female hormones estrogen and progesterone, marking the end of her reproductive years. Some women look forward to menopause because they find menstruation uncomfortable, and they go through it without major issues. However, for others, it can be very challenging, almost like a nightmare, with intense symptoms that can disrupt daily life. Typically, menopause occurs between the ages of 45 and 55, though it can happen earlier due to factors like genetics, certain surgeries, medications, radiation therapy, and autoimmune diseases. When menopause occurs before the age of 40, it's known as early menopause. What happens during menopause? During this phase, there's a significant drop in female hormones, leading to the numerous symptoms many women experience. To clarify, menopause is defined as the date of the last menstrual period, but doctors typically wait a full year to confirm that this was indeed the last one. If you menstruate again within 6 months after that, then your menopause date would be the date of your last period. If you're still having periods but noticing several symptoms, you're likely in perimenopause, where your hormone levels are already lower than before, but menopause hasn't officially begun yet. And surprisingly, menopause can last anywhere from 2 to 10 years, with both physical and psychological symptoms that can significantly impact a woman's life. Now let's talk about the 10 classic symptoms of menopause, also known as perimenopause. 1. Changes in menstruation. One of the first signs is irregular periods. Your cycles may become shorter, bleeding may become heavier or lighter, and it can last longer, which may even lead to anemia. 2. Hair changes. Many women notice their hair becomes thinner and drier. They may feel like they've lost volume, and their hair doesn't grow as quickly. Hair loss is also a common concern. 3. Skin changes. As estrogen levels drop, the skin becomes drier, thinner, and less elastic. Collagen breaks down more easily, causing wrinkles to form where there were none, and leading to sagging skin, which can give a less firm appearance. 4. Nail changes. During menopause, nails may stop growing as fast and become more brittle. You may notice the natural shine fading, along with fine lines or even ridges on the nails. 5. Hot flashes. This is one of the most uncomfortable symptoms. Hot flashes are sudden feelings of heat that start from the chest and move up to the head, lasting anywhere from a few seconds to several minutes. 6. Weight gain. Women often gain fat around the arms and abdomen as their metabolism slows down. This is accompanied by muscle loss, and in many cases, a lifestyle change from being active to more sedentary, which can exacerbate weight gain. 7. Night sweats. Excessive sweating during sleep can also occur, often with hot flashes. These can be so intense that you may need to change your sheets. This happens due to hormonal fluctuations, blood vessel dilation, brain changes, and even emotional factors. 8. Mood swings. Anxiety, irritability, and even depression are common. This isn't just because of hormonal changes, but also due to an imbalance in brain neurotransmitters such as serotonin, which regulates mood, sleep, and appetite, and norepinephrine, which affects attention and focus. You may also experience a drop in dopamine, the motivation neurotransmitter, making it hard to concentrate. 9. Vaginal dryness. Many women experience vaginal dryness during perimenopause and menopause due to a reduction in estrogen, which affects the glands responsible for lubrication. This, combined with reduced blood flow and decreased muscle tone, can interfere with sexual activity. 10. Fatigue and muscle pain. Hormonal changes, poor sleep, and psychosocial factors can contribute to fatigue, lack of energy, and muscle pain, all of which greatly affect quality of life. These are the most common symptoms of menopause, but there can be others, such as heart palpitations, tingling in the hands or extremities, dizziness, dry mouth, memory loss, burning sensations in the mouth or tongue, changes in body odor, and even changes in urine odor. Menopause is truly a delicate period for many women. Now, let's talk about 5 things no one ever told you about menopause. 1. You need to take better care of your heart. Many women fear breast cancer, and rightly so, but did you know that heart disease is the leading cause of death for women? Estrogen protects against heart problems, but after menopause, bad cholesterol rises, good cholesterol drops, and women who never had high blood pressure may start experiencing it. 2. Menopause increases the risk of dementia. Women are twice as likely to develop Alzheimer's as men. The decline in hormones like estradiol is one of the main reasons, as they help support brain energy. 3. It increases the risk of osteoporosis. Estrogen plays a role in bone formation. As estrogen levels fall, bone resorption increases, making bones more fragile and increasing the risk of fractures. 4. It raises the risk of infections. Immunity decreases during menopause, making women more vulnerable to infections, especially urinary tract infections. 5. It changes your metabolism. Fat accumulation, especially in the belly area, and muscle loss slow down the metabolism, making weight gain more likely. It also increases the risk of type 2 diabetes due to insulin resistance. In conclusion, menopause is a natural phase in a woman's life, but it can bring many challenges. Symptoms vary greatly from one woman to another, which is why it's crucial to seek medical advice to ensure you're taking care of your health in the best way possible. Your doctor can help you understand what's happening with your body, offer appropriate treatments, and guide you through this phase with a better quality of life. Never hesitate to seek professional help to take care of yourself. If you enjoyed this video, don't forget to like it and share it with your friends and family. And remember, information is the key to a healthier life. See you in the next video.